This is our presentation for how cancer impacts oral health. We are from Columbia Basin College Dental Hygiene Program, and we are in our second year of the program. My name is Sarah Tips, and also in this presentation will be Kylie Reinhart and Kyla Castilleja. Oral conditions that are associated with cancer are xerostomia, caries, oral mucositis, and emesis is also an associated condition. Xerostomia is the first topic we are going to be talking about. Xerostomia defined. Xerostomia is defined as dryness of the mouth. It is related to medications, low water intake, radiation, and chemotherapy, and it increases a patient's risk for infection, caries, and it also compromises their speaking, chewing, and swallowing abilities. Look at how many patients you see that fit into these categories. Patients with xerostomia have diminished chewing and swallowing ability, which contributes to malnutrition. Which patients that are undergoing radiation and chemotherapy, the last thing we want is them to be malnourished. They need their strength for these procedures. Xerostomia management. Water. You need to have frequent sips of water. Staying hydrated is important to reducing xerostomia effects. Using salivary substitutes. Sugar-free mints help stimulate saliva. Xylitol and fluoride. The next topic we're moving on to is carious lesions. Carious lesions defined is a breakdown of teeth. It is either the crown or the root. A carious lesion is a sum of several factors, such as bacteria interacting with sugars and production of acids that break down tooth structure. Radiation caries is very specific, on the other hand, and is tooth decay at the cervical region, which is the region of your tooth that is near the gum line. The incisal edges and the cusp tips are secondary to xerostomia induced by radiation therapy to the head and neck. Saliva acts as a buffer which protects the teeth against acids that break down enamel. In patients with xerostomia, the amount of saliva is diminished, and therefore there is little to no buffer against these acids or these acids attacks, leaving patients at higher risk for carious lesions. Carious lesion management. You must maintain oral hygiene with a soft bristled toothbrush. You don't want it to be rough on your skin and tear up the tissues. It can be softened further if you put the toothbrush under hot water because it makes the bristles more malleable. Incorporate the salivary substitutes. Sugar-free mints also, because you're sucking on something, which helps induce more saliva flow, which helps flush the bacteria out of your mouth. And frequent sips of water also help with that flushing criteria.
The next condition we will be covering is oral mucositis. Oral mucositis defined. Mucositis can be defined as inflammation of the mucous membrane lining the digestive tract from the mouth to the anus. When this inflammation is specific to the oral or oropharyngeal region, we use the term oral mucositis. Oral mucositis encompasses a variety of signs and symptoms. Some of the signs and symptoms are red, shiny, or swollen mouth and gingiva, blood in the mouth, sores in the mouth including on the gums or tongue, soreness or pain in the mouth or throat area, difficulty swallowing or talking, a feeling of dryness, mild burning or pain while eating, soft white patches or pus in the mouth or on the tongue, and an increase in mucus or thicker saliva in the mouth. Treatment options for oral mucositis are increasing the water intake to at least 3 liters per day, swishing with glycerin, which is a viscous liquid that can help to coat the oral tissues, using an ultra-soft toothbrush, keeping lips moist, although avoid Vaseline as it can promote infection, avoid oral irritants such as hot or spicy or acidic foods, alcohol, including alcohol mouthwashes, hard, coarse, or crunchy foods such as crackers, abrasive toothpastes. You want to limit dental floss and avoid lemon or glycerin swabs with toothbrushes unless the toothbrush has a soft bristle in order to avoid preventable oral injury. Another option is rinsing the mouth before and after meals. Two options for rinses are normal saline, 1 teaspoon of salt to 32 ounces of water, or salt and soda, 1/2 teaspoon of salt to 2 tablespoons sodium bicarbonate in 32 ounces of water. Additional considerations for patients with dentures or partials are to remove when possible to expose the oral tissues to air. Some patients find nighttime to be an ideal time to remove their denture or partial. Loose-fitting dentures can irritate the tissues and should not be worn, and do not wear dentures if mouth sores are severe.
The next topic we're going to be talking about is emesis. And on this slide, I want you to just take a moment to notice what the inside of these teeth look like. So that's the lingual surface of the tooth because it's on the tongue side of the tooth. And just notice how there's a little bit of wearing away, also known as erosion. Keep that in mind for the duration of this topic, please. So emesis, as you probably all know, is an act or instance of vomiting, and in your guys' case, it's related to chemotherapy, radiation treatments. So this increases the risk for erosion, so that's what you saw on the slide we were just on. That's wearing away of the enamel surface, and since enamel is the hardest tissue in the body, if that's worn away, then that'll put the patient at risk for our second point, sensitivity, and our third point, which is carious lesions. So that wearing away of the enamel, or like the protective cover of the tooth, will kind of pave the way for bacteria to have access to the softer portions of the tooth, which is the dentin. Emesis also puts a patient at an increased risk of malnutrition because if they have a lot of sensitivity, they may not want to eat certain foods. And they can also be at risk for oral inflammation because they have all of that acidic stomach fluid and content coming up into their mouth. So that could wear away at the mucous membranes, leave a bad taste, and just cause some discomfort for the patient. Some ways to manage emesis include using sensitivity toothpaste to combat that sensitivity that's caused by erosion. You can use a fluoride mouthwash before bed because that'll promote remineralization of those tooth surfaces that have been eroded away and could potentially help the patient in their sensitivity of their teeth. You can also wait 30 minutes after emesis before brushing. That's just so that you're not brushing any of the acidic material into the patient's tooth. I know that sounds kind of weird because they're spitting everything out of their mouth, but if that acid is still sticking around in the mouth and you're brushing it onto the tooth, then that could promote more erosion and more destruction of the tooth surface. So waiting 30 minutes is a big rule of thumb to follow for patients brushing after they have a vomiting incident. Also, rinsing with sodium bicarbonate after emesis is a good way to combat the effects of emesis. So one combination that we found in our textbook is you use 1/2 teaspoon of salt to 2 tablespoons of sodium bicarbonate, so baking soda, and you put that in 32 ounces of water, and then you let the patient swish with that after right after they vomit. And that will kind of neutralize the pH in their mouth, going from an acidic environment to a more neutral environment, just because of the alkalinity of the sodium bicarbonate mixture. Our last topic will be on fluoride. So just a little bit of an intro to fluoride. I know that a lot of you probably know what fluoride already is because I know that Tri-Cities Cancer Center partners with Dr. Osler, who's a local dentist, to get patients on track before they come in for some of their head and neck radiation treatments. So if this is review for any of you, just bear with us. But for anyone who needs this review or a good refresher, this is a slide for you. So fluoride is a compound of fluorine that strengthens tooth enamel and makes it less susceptible to dental caries. The benefits of fluoride are reduced sensitivity, reduced caries risk, and prevents loss of tooth structure, and it also promotes remineralization. So fluoride, when it's combined with some of the minerals in the mouth that are already being secreted by saliva, it'll make a stronger remineralization material around the tooth so that the patient will have stronger teeth after using fluoride varnish, a fluoride rinse, fluoride toothpaste, anything like that. So using fluoride, especially for patients who have xerostomia, or let's say oral mucositis, anything like that, that'll promote some good remineralization with a nice strong mineral.
To summarize, cancer patients are at an especially high risk for multiple oral complications. It is important to educate cancer patients of their risks for oral complications. Implementing preventative care can avoid cancer treatment delays. By implementing the preventative and palliative care procedures we mentioned during this presentation, you can help to improve your patient's quality of life. Interprofessional collaboration is vital to ensuring the wholest care of cancer patients. Being aware of the oral ailments associated with cancer treatment and their risks enables all of us healthcare providers to be advocates for disease prevention of this vulnerable population. Here's the list of references we used in order to create this presentation. Thank you for your time and for helping us fulfill this requirement for our program. Thank you also for your essential service during this time, and we hope that you are all staying safe and healthy.